Hello, my name's Charlotte. I'm from Skylark Vets, and today we are going to talk about how to use an asthma inhaler and a volumetric spacer for our asthmatic patients. There are varying medications that we use, but quite commonly we might use something called Flixotide. They come in different sizes, so we'd prescribe it according to the size of your pet. We normally, as I say, prescribe them to you with something called a volumetric spacer, which is this one. It's designed for children, but it works very well for varying animals. If you have a small mammal or a bird, sometimes you can physically put them inside the spacer to use the medication, but others, dogs, cats, or indeed some birds, you can just get them used to having the face mask near them. So I'm going to open it all up as is, so that you can see how to fit it together. So the spacer device comes with 3 different parts in the packet. It will come with a soft face mask, which again you can use in birds, dogs and cats. It's probably better tolerated in dogs and cats than it is in many of the other animals, but it is quite comfortable on the face, so you literally just pop it on like that. It doesn't hurt them, they get used to it after the first couple of times really quite quickly, it's surprising. The second part is what looks a bit like a cocktail shaker, but it's not. It's actually the device that allows the inhaler material to be dispersed throughout the air before your pet breathes it in. So it's really easy to put together. It's just got a little notch on one side that's cut out here that fits into a notch on the other. The blank one obviously doesn't have any writing on it, so that's the one with the cut out notch that fits over the other one. So it creates a cone structure, and the idea of this is literally just to make the substance of your inhaler spread out through your air gap. Now, as I say, if you have something like a hamster, guinea pig, whatever it is, sometimes you can actually just use this without the rest of it. You can just use it as half of one and pop your pet in there. If you can get them used to the face mask, that's often a little bit better, and it just fits on the end, like so. And then you have your inhaler on this end, which I'll show you now. So this is what the inhaler looks like. It's pretty similar to a human inhaler, as you can see, primarily because they are human inhalers. So they have a cap on them. You just take the cap off. The inhaler then slots into the end of the volumatic spacer device. So it literally just sits in there quite snugly. So if you can train your pet to pop their nose in there, or indeed their face, depending on what size it is, it's very easy to administer this. You just use 2 puffs of the inhaler. It spreads out through the air in here, and then your pet breathes in at the end. Or however many puffs you're directed to use by your vet. It may not be 2, it might be 1, might be 3, depends on the size of the animal and how much of the medicament we're using. If you think that that's going to be too distressing for your pet, as I say, you can use it without the latter half. You can just take this part off, so you have the inhaler at the end here. And again, you just get your pet to be at the end. The closer your pet is, the better dispersion you're going to have of that drug, because the whole point of this cone structure is it stops it from dispersing into the outer air. Obviously, as a human, if we were going to use an inhaler, we would put it into our mouth and breathe it all in. So we need to make sure your pet's getting as much as possible. From that point of view, if you can train them to use this part, it's much more effective because they'll get everything coming out of this end part here. If you can't, as I say, don't panic. We just work with what we can get. So if you can get them to pop their head in there, that can work equally well. If you have a really a well-handled pet that's not too worried about things, some of them can get used to just using the inhaler as we would, so putting it into their mouth. But generally speaking, they do work better with the volumetric spacer devices. It really is very easy. It's very scary when your pet is first diagnosed with asthma or another respiratory problem that you're going to use one of these for, and everybody does usually panic about how their pet's going to get used to it. Generally, we find on the first time, pets are a little bit sceptical about what's going on. However, the effect of the medicaments in the inhalers is very fast acting, usually over seconds rather than minutes. And the effect of that, they do realise, is directly related to what you've just done. So we tend to find that as things go on, they become more and more used to using those inhalers, and they really don't have any problems at all.